Hi, my name is Siobhan Kehoe, and I am currently a practicing gynecologic oncologist at UT Southwestern Medical Center. I joined this institution in 2009 after completing my fellowship in gynecologic oncology at Memorial Sloan Kettering Cancer Center in New York City. What is the CA-125 test, and what does it indicate? CA-125, or cancer antigen 125, is actually a complex protein that is encoded by a specific gene in our body, the MUC16 gene. CA-125 is a protein that can actually be detected in the blood by a simple blood test. CA-125 can be released by cancer cells and therefore may be elevated in the blood of some patients with specific types of cancers, one of which is ovarian cancer. Unfortunately, this protein can also be elevated in other conditions, in benign conditions like endometriosis or uterine fibroids. Therefore, it is not a very specific test. However, current research is very exciting and may show that the combination of monitoring the trend of an individual's level of CA-125 over time, along with pelvic ultrasounds, may help us detect ovary cancer at an early stage. For now, if the level of CA-125 is elevated in a gynecologic cancer, then monitoring it will help us determine if the treatment is working or if the cancer has recurred. What does cancer stage and cancer grade mean? We use the stage of a cancer to determine the prognosis of that particular cancer. It also can help guide us in the treatment strategy for the patient. Staging is usually determined by a surgical procedure, which allows us to determine if the tumor has spread beyond the primary site of origin. Cervical cancer, however, is an exception in gynecology, as this cancer is staged clinically by a clinical exam and radiologic results. The grading system refers to the actual tumor cell itself, and often is characterized as low or high grade, or even as simple as grade 1, 2, or 3. The grade is determined by the pathologist, who is looking at the tumor at the histologic level, which means she is simply looking at the tumor cells under a microscope. The grading system then helps clinicians determine whether the cancer is more or less aggressive. For example, a high-grade tumor tends to proliferate or grow faster and more aggressively than a low-grade cancer is. After the initial cancer diagnosis, what should a patient do? If a woman is diagnosed with any gynecologic cancer, she should absolutely be seen and treated by a gynecologic oncologist. I think it is a very good idea to have done some homework prior to the visit. You should also have questions, because this allows your gynecologic oncologist to provide you with more detailed answers and to guide you to better website information. I think it is also very important for you to have access to not only a gynecologic oncologist, but to social workers and other support systems. Support systems established can provide better care and resources to each patient as well as her family. I'm worried about getting cancer. Can I prevent it? Unfortunately, there is no perfect solution or answer to avoid cancer. However, there are some things that can help decrease your chance of getting cancer. Now, dieting is not the answer, but rather focusing on eating a well-balanced, nourished meal. It is very important to incorporate all the essential food groups and vitamins and minerals into your diet and to avoid excess sugars and unsaturated fats. We know that leading a healthy, active lifestyle decreases your risk of cancer. Exercise is a crucial part of maintaining a fit and lean physique, which helps decrease the risk of cancer. Being overweight or obese significantly increases your risk of many types of cancers. It is also important to avoid toxins. Therefore, don't smoke and limit alcohol consumption to decrease your risk. Finally, visit the doctor, not only for annual visits, but if you are concerned about certain symptoms that you are experiencing. It is very important to relay those to your doctor. If you think there may be something wrong, don't be afraid to tell your doctor and to ask him to listen to those symptoms and to address your concerns. Women often spend most of their time taking care of others. Be sure to take care of yourselves.